Good morning, everyone. Dear friends, I'm grateful to have the privilege to speak at such a distinguished event. I'm humbled by the opportunity not only to shape the world that we have now, but to envision how the world could and should be. I want to extend my warm appreciation to the sponsors and organizers and everyone who has done so much work to get us here today. I'll start by asking us to consider a few questions. First, what is the value of life? What is the value of your neighbor's life? What is the value of your own life? You see, in Nigeria, where I come from, when a child develops a very high fever and slips into a coma, the two commonest causes that readily comes to the mind of a physician is cerebral malaria or meningitis. Now, if the diagnosis is meningitis, the child will need to have a twice daily dose of antibiotics that cost about 80,000 naira or about $220 to complete the regimen. Now, Nigeria's current minimum wage stands at about 18,000 naira. That is about $50. After parents are presented with the bill from the pharmacy, most of them return to me pleading, "Oh, doctor, is there nothing else you can do apart from using these drugs? What if I don't get it? What will happen? Is this how my child will die?" You see, these questions leave me troubled, and I'm not at peace with myself. It is at such times that I ask the questions: what truly is the value of life? What is the value of the life of my neighbor? Now, if we think that this challenge exists only with children and infectious diseases, we would have to think again. Very few things are able to tip one into a state of utter penury and a lack of independence in many African countries, like being diagnosed with kidney disease and the subsequent need for dialysis. Now, I'm sure at some point this morning, all of us had to tinkle, as we say in local parlance. You see, the ability to pass urine, a seemingly simple human routine, is not the least simple for millions of patients globally. Patients have to be connected to a machine to remove waste that would ordinarily be filtered out by our kidneys in urine. Now, this procedure is carried out in 3 to 4 sessions every week and costs about 100,000 naira weekly, about $275 a month weekly. Dear friends, see, my monthly remuneration as a doctor in Nigeria is about $400 a month. Now, if today, Monsignor, I come down with a kidney disease needing dialysis, sadly, I won't be able to afford 2 weeks of care. At this point, I'm perturbed, and I also ask the question, what is the value of my own life? The awareness that no one has to suffer financial ruin when exposed to ill health, or the notion that anyone is unable to afford life-saving care when in need, lies at the heart of the model called universal health coverage. Universal health coverage, as a strategic tool for improving the health of populations, have been proven to be highly efficient and cost-effective. So let's ask ourselves, if something is so beneficial, why are we not doing it yet? For millions who are directly affected by the rising cost of healthcare and consequent unaffordability, universal health coverage sits squarely at the nexus of social justice, equity, and the time-honored principle of fraternity. It seeks to pool funds to guarantee risk coverage from ill health, bearing in mind that no one ever plans to fall ill or enjoys it, to say the very least. ensuring people achieve high-quality care where they are and when needed, without being pushed into the poverty trap, remains the lofty goal of universal health coverage. At the Commonwealth Youth Health Network, over the last 1 year, we have contributed to strategic global meetings representing the voices of millions of young people in negotiations around how universal health coverage can and must be achieved across regions and countries. Most recently, at this year's UN General Assembly, in collaboration with the International Federation of Medical Students Association, IFMSA, the Commonwealth Youth Health Network organized a side event on health equity and financing, which brought together young people and top policymakers to capture youth perspectives on delivering universal health coverage. At our side event, we sought to understand strategic areas where the energy and passion of young people can be harnessed to guarantee better health outcomes, and how to best mobilize young people as advocates for more equitable health systems. Following our side event at the GA, we immediately followed through with a closed-door meeting with the WHO Director General, Dr. Tedros Adhanom, a fine man who is committed to ensuring the realization of universal health coverage as a core mandate of his leadership. In our meeting with Dr. Tedros, we sought to institute a formalized engagement mechanism for young people with the WHO. Currently, young people don't have a formalized way of engaging and interacting with the WHO to contribute our perspective on health policies and the future that directly affects us. Work on this is currently ongoing with the WHO, and I'll do well to give regular feedbacks as we progress. Currently, we hope that we can set up a mechanism that will be discussed at the World Health Assembly in Geneva, where we hope for it to be ratified and for it to become implemented. The 2030 agenda we dare to speak so boldly about is a future we are already inheriting as young people. It's a future we would live in. It's a future that directly impacts how much of our potential we can fulfill. Dear friends, the peace and prosperity for all people that we so dearly seek is not a lone ranger. This peace and prosperity work steadily in concert with justice, with equity, with transparency. Achieving universal health coverage for the millions of people currently exposed to financial risk and who lack health insurance or have minimum financial protection from their current insurance plans is a steady, surefire way to building more peaceful, inclusive societies. Societies that capture the ideals of togetherness, the ideals of fraternity as it should be. This ideal is pertinent in our time. I'll end by asking us the same questions. What is the value of life? What is the value of your neighbor's life? What is the value of your own life? And if we know so much good, if we know what to do, why then are we not doing it yet? Thank you so much for listening. It means a lot. Thank you.